Healthier Together, sponsored.
The peak of the COVID-19 pandemic behind us, but workforce issues remain. And right now, 46% of workers say that they're feeling burned out.
In this week's Healthier Together, we sat down with Dr. Franz to discuss the top causes of burnout.
On a national basis, 46% of U.S. workers reported being burned out from their jobs. And this was also higher in women than it was with men, as well as higher with younger people. Some top causes of burnout include increased workload, staff shortages, work-life balance being out of sync, a lack of communication and support from their employers, and additional time pressures. Indeed, the World Health Organization found that depression and anxiety alone cost the global economy more than $1 trillion each year, and this is predominantly due to reduced work productivity. So many of the workforce issues brought on by the pandemic have not gone away. People are still struggling with remote work. Some folks never really got used to it or didn't like it. They feel disconnected from their colleagues and their peers. There's some evidence that suggests that people working remotely may have contributed to increased overall work hours and time spent away from their family or leisure activities. In fact, Microsoft 2022 Work Trend Index indicated that between February of 2020 and February of 2022, that there were 6 billion more emails sent than previously, and that Teams meetings increased by 252%, and that the actual after-hours workload of employees increased by 28%. Now that we're coming out of COVID, some employees are also struggling with the fact that their employers want them to return to the office. They're stressed with that and with that change. There's also the fact that a lot of employers are struggling with staff shortages, and the existing employees find that they have to cover for the work of others that they didn't have to pre-COVID. And as we all know, COVID caused what we call the Great Resignation. People have really been rethinking the prioritization of work in their lives. And this continues to happen. So there's a lot of philosophical thought that can cause some angst around whether or not the job is a good fit or where workers should be spending their time. And while this to a degree is healthy, some employees are really dwelling on this, and this is further impacting their unhappiness and their sense of burnout. So there's no easy fix here. I would certainly encourage employers, and especially managers, directors, those in leaderships that have direct reports, to really, work on their soft skills, develop, that interpersonal aptitude that's needed to maybe be aware if you have an employee that's particularly struggling. Certainly, we want to destigmatize behavioral health in the workplace and really treat it just like any other medical condition as far as when employees are struggling or need help. Be aware of maybe what some of the warning signs are of some mental health challenges. Not that employers need to get in the business of diagnosing, but just being aware and helping to facilitate when employees do need some additional help, how to connect to resources.
And a reminder for you, you can find all of our Healthier Together reporting on Fox 13.